More concerns tonight over the pipes that carry our drinking water. We appreciate you joining us on this Wednesday. I'm Kimberly Hunt.
And I am Wale Aliu. As Team 10 reported Monday, nearly 2,000 miles of aging asbestos cement pipes in the city of San Diego are still carrying tap water. That's alarmed some experts who are concerned the deteriorating lines could be leaching out asbestos into the water.
We need to be very thoughtful and careful about that remediation process.
Tonight, Team 10 investigator Austin Grabish uncovers what one advocate says is a staggering lack of protection for city workers sent to replace those pipes when they fall apart.
They had hard hats, boots, even reflective vests, but no face respirators were in sight as these workers repaired a broken asbestos pipe in 2020. This photo, obtained by Team 10, is raising questions about the protection given to San Diego city workers.
There were many different areas in the photographs that I noticed where most likely those workers were exposed.
Linda Reinstein is the president of the Asbestos Disease Awareness Organization. Reinstein is from National City and has spent decades fighting for stronger asbestos regulations. She created the nonprofit after her husband, Alan, died from mesothelioma. Team 10 asked her to comment on more than 100 photos we obtained for my investigation on San Diego's aging asbestos water mains. In the investigation, we revealed San Diego has nearly 2,000 miles of deteriorating asbestos pipes carrying drinking water. Some experts are concerned that poses a cancer risk, but the city maintains San Diego's water is safe. As part of my investigation, I filed a public records request asking for photos of broken concrete asbestos water pipes from 2015 to 2023. What Team 10 obtained shocked Reinstein.
Frankly, as a Californian, it was staggering to see workers that were cutting pipes that didn't have proper PPE and clothing.
Experts have long agreed inhaling asbestos can cause cancer, and they warn the removal of asbestos pipes needs to be done carefully.
I fear for the workers, first of all, who put it in, but even those that now have to come and remove the broken pieces of pipe. I've seen disease develop in workers who have removed and worked with as waste asbestos cement pipe.
Team 10 asked Cal OSHA what PPE employees must have when removing and cutting asbestos pipes. A spokesperson sent us this website that has a long list of state regulations. The site says asbestos cement pipe or sheet can emit airborne fibers if the materials are cut or sawed or if they are broken. And it tells employees you are required to wear a respirator when performing tasks that result in asbestos exposure that exceeds the permissible exposure limit. It's not clear what the exposure levels were the day these photos were taken, but in general, exposure to asbestos indoors is greater than outside. Asbestos expert Dr. Arthur Frank says workers should be wearing a face respirator regardless of the legally allowed exposure level. He's been studying the harm asbestos can cause for more than 50 years and points out OSHA's own website says there is no safe level of asbestos exposure.
There's a lot of money involved in paying compensation to people that have been harmed, and clearly people who have worked with asbestos cement pipe have been harmed.
The American Cancer Society warns asbestos fibers can become aerosolized when pipes are removed. Dr. Lauren Terrace says stringent measures need to be in place to protect workers. She says that includes sealing off an area before asbestos pipes are removed.
We need to be very thoughtful and careful about that remediation process because we know that process in and of itself is going to lead to carcinogens being in the air.
Team 10 asked the city what it does to protect workers and how it ensures asbestos fibers don't become airborne. The city sent us this 7-page internal policy for workers handling asbestos pipes. This document says it is safe to handle asbestos concrete pipe that is in good condition without wearing additional PPE. The document says the city's guidelines meet or exceed federal and state regulations. One of the city's procedures includes keeping asbestos pipes wet to prevent fibers from becoming airborne. Another is flushing the water lines to remove any residual asbestos that may have entered the pipe.
I think that's almost impossible. In the state of California, where it's 75 degrees and sunny almost all the time, it's nearly impossible to keep a pipe wet the entire time. And it's also not the most protective thing to be using to repair pipes.
The city's internal policy says it's safe to handle asbestos concrete pipes that are in good condition without workers wearing additional PPE. What do you make of that?
Well, as a mesothelioma widow, I would say that's ridiculous. Every worker should assume that those pipes are dangerous and have the proper training and the PPE that is required to keep them safe.
Reinstein says Team 10's investigation shows how big of a problem legacy asbestos continues to be and why tougher rules are needed.
There should be a massive comprehensive legislation and legacy plan to prevent all exposure in cement pipes and beyond.
A plan to protect Americans from disease and heartbreak. Austin Grabish, Team 10.
You can find the first part of Austin's investigation into asbestos pipes on 10news.com. Just click on the Team 10 Investigates tab at the top of the page.